My name is Bobbi Kolonay, and I'm a aging life care manager. I am a registered nurse by profession and also have a lot of certifications in the holistic realm of medicine. This is my fourth year serving on the board of directors of the Aging Life Care Association. And in the Pittsburgh area where I was from, I was on their board, very active with the decisions that we have to make to keep Aging Life Care Association on the cutting edge of dealing with people as they age. So we offer a little bit of a unique service in my practice. And it has to probably do with my background. As a strong clinician, I've always been very cerebral and very scientific in analyzing the needs of my clients, and I still am, only I'm coming from a different perspective. So what I found after being in this business for a while is a lot of the things recommended by current methodology in medical care does not allow the person to age well. Medications, testing, hospitalizations, invasive procedures don't allow aging well. So what we've tried to do is bring it down to the level on what does. And I went to China to learn traditional Chinese medicine with holistic practitioners for about a month. I've traveled internationally, and when I do, I always observe what's happening in other countries and even try to visit places in other countries. In Amsterdam, there is a dementia unit that's like a village, so I made sure when I was in Amsterdam I went and visited that. I have studied as a herbologist, and I have a certification as a clinical aromatherapist and a Reiki master and several other different areas. And so we use all this to help the person to age well, if the person themselves is interested. We start with food as medicine, and if the person's interested, we'll offer ways of reducing body inflammation that could be causing pain just by using food, as one example. I make herbal creams I make arnica. It's actually my best-selling cream, and it helps break down bruises and any kind of inflammation. It seems to be really, really successful with. So that's one of the creams that our clients buy, and so rather than taking like a non-steroid anti-inflammatory like Advil, we would recommend they take turmeric. And again, we work with the doctors to make sure this is okay. The client themselves, if they're interested, and as much as they are, we will be glad to provide that service. We recommend, it depends on what level they're at and what comfort they are. We have a client that has breast cancer, and she's on her second stage of chemotherapy, and her white blood cells, she was having problems with her cells in her body, and immunosuppression. So she was getting a lot of infections. And one thing that's highly successful with that is acupuncture. So I have an acupuncturist at my office, and she went for visits there, and her blood counts all went up. The blood counts, the cells that fight infection in your body, all rose in a matter of actually 2 or 3 treatments with acupuncture. So we found success with that, and a lot of neurological diseases. We'll use massage. We'll use energy medicine like Reiki or acupuncture, or even people that have Parkinson's or any kind of disorder that you have neurological reasons why you could fall. We recommend like Tai Chi types of bodily movements, and they like it, and it's successful, it works, and you're not putting anything in your body that could be causing more harm. There's so much published in medical journals and in PubMed, which is where you go for medical studies. So it's not something I'm inventing or creating, it's all out there. It's just not the standard use of care, but 5 years or so it may be. The goal is to be the leaders in assuring that the population ages well.